Good morning, everybody. My name is Kenny Ruffin, and I'm glad to see you guys here. I'm a City of Riverdale council member and also secretary of the Georgia Family Connection Partnership. I just wanted to read a description of the Connection Partnership, which is Georgia Family Connection is the only statewide network in the country dedicated to the health and well-being of families and communities. We empower communities in 159 counties to craft local solutions based on local decisions. GAFCP does good and important work across a number of issue areas. One thing I hope you take away with you is when you go back to learn who and have contact with your local collaborative, okay? In April, GFCP released the second edition of the Georgia Civic Health Index. I'm very pleased that GMA partnered with GAFCP on this report and is highlighting it today. Georgia's civic health is still not strong. In fact, civic health in the Peach State has declined in most of the 21 civic engagement measures since the first report in 2013. During the past 6 years, voting in local elections dropped from 29 to 40th. Volunteering dropped from 34 to 44th. Contacting a public official dropped from 34 to 49th, and that's a problem for us. Group membership or participation dropped from 28th to 49th, and donating to charitable or religious organizations dropped from 40th to 47. This is important as our civic health does matter. Research has linked civic health to workforce development, child development, adolescent well-being, mental health, and other public health outcomes, access to opportunity, community vitality, lower violent crime rates and youth delinquency, and reduce mortality. So today we're going to hear more about Georgia's civic health and how two communities are going about improving it. I'm going to briefly introduce today's speakers and then let them take it from there. Gay Smith was appointed Executive Director of Georgia Family Connection Partnership in 2001 after serving as President, CEO of Parent and Child Development Services, Inc. in Chatham and Effingham counties. I'm going to introduce you guys right before you come up, okay? So here we have Gay Smith.
Okay. I'll put the video while you're introducing yourself.
Good morning. So, thanks, Kenny. I think from now on, instead of my having to do the tee up on Georgia Family Connection, I'll just take you with me. So, we do have, well, first of all, let me ask, how many of you are familiar with your local Family Connection Collaborative? Yay, great, it's great. So we have a really brief video that sets up everything that Family Connection, how we were created, what we do, how we do it, that has actually, we were joking, literally has taken about 40 minutes off of one of my presentations because we were able to get it in this really nice, concise 2 to 3 minute video. So what we wanted to do is share that video with you, and then I'll make a few more remarks, but the real reason you're here is to hear about our most recently released civic health report and from our two communities. So I'll do what a friend of mine who is a retired military colonel says, I'll be brief, I'll be brilliant, and I'll be seated. But, or at least I'll try to do 2 of those 3, and it'll probably be brief and seated. So with that, we're going to start the video.
Here, let me.
Oh.
Yep. And it should be pulled right up. There it is. All right. Go ahead and full screen it. Oops, did I? Oh, I hit pause.
Growth and prosperity of our state is deeply rooted in our communities and the health and productivity of the children and families within them. But hardworking families across Georgia find themselves struggling to become and remain healthy and self-sufficient. And while help is available, it's often not accessible. Our most vulnerable citizens get lost in the complexities of a disconnected and overly stressed system. and efforts to meet their needs are fragmented, missing, or unnecessarily duplicated. In both the private and public sectors, it's not enough to work hard for our children and families. We must work for them together. Georgia Family Connection was established to meet the desperate need for a statewide organization to disentangle the mess of barriers, service gaps, and inefficiencies obscuring progress and positive community outcomes. With the legacy of sorting complex issues and achieving lasting impact, we foster relationships between community leaders, investors, and lawmakers advocating for system changes. As the only statewide organization of its kind, with partners in all 159 counties, we have a unique vantage point that allows us to see the big picture while operating effectively at a local level. Our powerful network of collaboratives crafts local solutions based on local decisions. Every day, they tackle the challenging work necessary to realize sustained improvement in the conditions, prospects, and outcomes for our local children and families. In this vast web of people and services, every relationship matters, and every connection holds possibility. Georgia Family Connection maintains, simplifies, and supports this social infrastructure. Across 5 key result areas, none of which can be considered without the others, we leverage disciplined collaboration to yield a measurable collective impact. Together, we envision a Georgia where all children are healthy, primed for school, and succeed when they get there, and where strong families contribute to vibrant, robust communities that thrive. Together, we can forge lasting positive change for children and families. Together, we can ensure a bright future for Georgia. And together starts with a conversation. So, let's talk.
And slideshow.
So as you just heard on the video, we have a network of local collaboratives, 159 counties, and they all are charged with pulling and engaging partners together, assessing the data of what's happening in their community, developing a strategic plan with strategies, and then being accountable for implementing that plan. And what we do at the state level is support that network with technical assistance, and specifically, we are the Kids Count grantee for the state of Georgia. And you may have heard just recently the rankings were released, and Georgia has improved to number 38 in the country, which we were originally ranked at 48 when the rankings were released back in '91. But we provide data to the local collaboratives to make good decisions, as well as to our state partners and elected officials. We also try to link our communities to state-level initiatives like our Get Georgia Reading campaign, which has the expectation that every child in Georgia will be reading proficiently by the end of 3rd grade. We're also key partners in the quality rated of early learning centers across the state. We're also partnering with DFACS around the child welfare reform that our state, well, our whole country is going to be moving through over the next couple of years. And also this, while you're here today, the Civic Health Report is something very important to us in GMA, because when you look at that 5th result area, the thriving, vibrant communities, this is one way that we can take a close look at that, open up conversations, and develop strategies for how to improve civic engagement and civic life in every single community in Georgia. So with that, I'm going to turn it over to Rebecca Rice, who will hit some of the highlights of the report, and then we'll hear some really specific stories from our communities. Thanks.
Okay, now we'll bring up Rebecca Rice, is the Kids Count Manager for the partnership. She joined the partnership in November of 2012. She received her Master of Public Health from Emory University in 2012. Okay, thanks, Rebecca.
All right. And I've been told the clicker works, which is exciting. The last time I gave a presentation, it did not work. So, hey, I'm Rebecca Rice. Like they said, I'm the Kids Count Manager. I'm going to do my best to speak slowly. I was born and raised in Georgia, and you would never know it by the way I talk. But I'm going to try to go through some of these things slowly enough that I get my points across. So, you heard briefly from Kenny how important civic health is I'm going to define civic health in just a moment. So we talk about civic health. It was a term that was coined by the National Conference on Citizenship, which was an organization chartered by Congress in the early 1950s, meant to capitalize on a lot of the civic engagement kind of momentum that was happening in post-war America. Since then, however, civic health has declined. And so again, when we say civic health, we're talking about a lot of our really traditional civic engagement indicators. So voter registration, contacting elected officials, things that we, really concrete things we think of. But it also includes things like social cohesion and social capital. So it's how we engage with one another, with our very immediate circles of friends, families, and neighbors, our communities, and so groups that make up our communities, with institutions like the media and school systems and whatnot, and then in politics. And as Kenny said, so some of the reasons we care about civic health and civic engagement is because it's strongly correlated with a lot of positive outcomes we want to see. So typically speaking, communities with higher levels of civic health have lower violent crime rates, better public health outcomes, stronger workforce development, and economic resiliency, specifically during economic downturns. During the recession, communities that had strong cohesion had, I think, 3 to 5% lower unemployment rates than communities that did not have strong social cohesion. Improved mental health in both adolescents and adults. Improved adolescent well-being across the board. Reduced mortality and reduced unemployment. I'm going to get into some more of those. So, generally speaking, as Kenny said, Georgia's civic health is not strong. And for 17 of the 21 measures featured in this report, I meant to say, reports are at the back of the room. Please feel free to grab them on your way out. So, Georgia's health is not strong, and Georgia's below the national average for 17 of the 21 measures featured in this report. So, there's work to be done. Generally speaking, when we look at the data across different kinds of demographics, generally speaking, people with higher levels of income and educational attainment have much higher levels of civic health than other groups. Specifically, people with incomes that higher than $75,000 a year and at least a bachelor's degree have the highest levels of participation. However, if you look at Georgia's demographics, we have a lot of people in our state who make less than $75,000 a year and who don't have at least a bachelor's degree. So that tells us that it's a lot of the same people reaching out and making decisions and coming together over and over again, but that there's probably a lot of people who are at the table over and over again, and this is what the data say. So, let's call this the hit list. These are the highlights, or lowlights might be a more appropriate term for these. So some of the rankings in Georgia, and I should say these are survey data. So they come from a survey that's conducted all across the United States by the Census Bureau. It's called the Current Population Survey. And so these are questions that actual Georgia residents respond to describing their own behavior, which I think is really interesting. So according to Georgians' own response to questions, we rank 40th in voting in local elections. We rank 44th in volunteering. Volunteering is a really, really important indicator. I'm going to go a little bit more into it in a minute. We're 49th contacting a public official. So technically, this is out of 51 because it's all 50 states as well as the District of Columbia. So we're not quite next to dead last. We're 2 away from dead last in that one. Still. We are 44th in discussing political, societal, or local views with our neighbors. At just 7.7% of Georgians responded and said they did that. We're 45th in working with neighbors to do something positive for your neighborhood or community. That one really gets me. We're 49th in group membership or participation. And we are 47th in donating to charitable or religious organizations, which one of my colleagues always says, she's actually at the back of the room, this really kind of challenges the way, when I'm, again, Georgia native, when I think about Georgians, I really think of giving, caring, loving, social people. So when I see this, it really challenges kind of my ideas about how we think about ourselves and our neighbors. So, we're 50th in frequently hearing from or spending time with family and friends. I will say, I put the percentage in there because you can still see it's above 80%. So, the majority of our population frequently sees from or hears from friends and family, but we're still lower than other states on that particular measure. And we are 50th in talking with or spending time with our neighbors at just 24.2% of residents. So, we looked at the data set, we can look at it and slice and dice it across all kinds of demographics. So some of the things we saw within those indicators I just talked about are that rural residents reported frequently talking to or spending time with neighbors at a higher rate than state or national averages. And we found that residents with annual incomes of less than $35,000 reported talking to or spending time with neighbors at a higher rate than residents with higher incomes. That was the only indicator for which groups in the lowest economic kind of grouping, according to the survey, participated at a higher rate than people with the highest levels of income. So that was interesting. So I also have some slides that show where we're at least average or better. So Georgia is 29th, and we're actually exactly equal with the national average for frequently talking to or spending time with people of different races, ethnicities, or cultural backgrounds. So given how diverse Georgia is in so many different ways, I'd be really disappointed if we were way behind the national average on this one. So it's good. We're right in line with the national average. The only one where we are ranked better than 25 is we are 13th in the nation for posting views about political, societal, or local issues on the internet or social media. But we're 49th in contacting a public official. So there's interest there, but we got to find a way to move the interest to action. And I mean, the reason that we are showing this report at the Georgia Municipal Association annual convention, and the reason GMA partnered with us, is because there's a really key role that local elected officials can play in harnessing the interest and turning it into action. So we're 29th in the frequency that Georgians provide food, housing, money, or help to extended friends or family. So we're not there donating to charities, but we're at the very least helping our friends and family. In Georgia, millennials and Hispanic residents actually engage in that way, food, money, housing, or help, at higher rates than the state or even national averages. For all the bad things they say about millennials, we're helping our family. So what are some ways that Georgia can improve its civic health? As I mentioned in the very beginning, people with higher levels of educational attainment tend to participate in civic life at much higher rates than people with lower rates of educational attainment. So generally speaking, improving Georgia's overall educational attainment can improve. It's a best practice for improving civic engagement. And we have a lot of collaboratives who are focused on improving educational attainment from birth to 8 all the way through high school and college outcomes. So implementing high quality civics education. So I'll get to another slide that talks a little bit more about that in a minute. But there's research that shows that really high quality, evidence-based, participatory civics education can lead to increased civic knowledge and increased civic participation down the line for students who are exposed to this. And then increased opportunities for volunteerism among youth and adults. One thing we found when we were combing through research about improving civic engagement was that a lot of volunteering opportunities, it's unintentionally end up kind of being packaged and designed for kids who already are what they call socially advantaged in the research, which is kids who don't have to get summer jobs, kids who have plenty of time to do extracurriculars in the afternoon because they don't have to get out of after school jobs, kids who don't have to work on the weekends. So if you're in a position to offer volunteering opportunities to your young people, please make sure that they accommodate all of the groups and children and students in your communities, regardless of income. And I say that because, again, volunteerism is really, really important. Volunteerism is extremely highly linked with employment. People who have less than a high school diploma have, if they volunteer regularly, they have a 55% higher chance of finding permanent employment than if they do not volunteer regularly. That's a huge difference, and that's for the lowest educational attainment group in these data. So that's a really big finding. So again, making sure that your civic engagement opportunities and volunteering opportunities are accessible to all the people in your community, not just the ones who have a lot of time on the weekends. This is another piece that I think local elected officials can play into, modifying built environments to encourage face-to-face engagement among residents and decrease isolation. I am not a community architect, so if you are interested in what some of the best practices around there, I'd be happy to connect you with some of the research, but there are evidence-based ways to change your built environment in your community to improve civic engagement, and support and promoting voting in local and national elections. Those are some best practices according to the research for improving civic engagement. This is just an overview of what our kind of big areas of civic health work are. So we have the Civic Health Index, again, at the back of the room. We have the local civic health cohort. You're going to hear from them in just a few minutes. And we've also been partnering with the State Bar Association on what we call, it's a program called iCivics. I think I have a slide, so let's take it out. Hold on, I'm back. So iCivics is a free online evidence-based civics curriculum. It was founded by Justice Sandra Day O'Connor in 2009 because she saw declining civic participation and declining civic knowledge and was very concerned about what that meant for civic participation going forward in our nation. And as we see, the numbers have continued to decline. So this is one of those best practices for improving civic health. If you're interested, has anybody in here already heard of iCivics? Have you sat in our class? Okay. So anyway, if you're interested in implementing iCivics with any group in your community, and I should say originally they were really pushing iCivics through school systems, but teachers had a lot on their plates. So asking them to do another thing can honestly be difficult. So we've been partnering with community-based organizations, so Boys and Girls Clubs, summer feeding programs, after-school programs, to get iCivics into those arenas, since again, it's hard to ask teachers to do more than they're already doing with testing requirements and whatnot. So we've had some really cool successes around this particular program. Again, free, online, evidence-based. I was going to go back really quickly. So I mentioned our local civic health cohort. We have 6 counties who have collected local data, so the same data you see in the Civic Health Index, they've collected it at the local level. And those counties are Camden, Cook, Fayette, Macon-Bibb, Stevens, and Washington. We have Macon-Bibb and Stevens, or as Washington here today. I almost said Stevens. Washington and Macon-Bibb here today. So if you are in one of those counties, if you serve in one of those counties, feel free to talk to your family connection person and see the local data. Well, we can do it. I was just going to put a real quick plug in for Census 2020. I'm sure all of y'all have heard at this point GMA folks talking about the importance of 2020 census, which is a kind of a subset of civic participation. And I'm just here to say really quickly, I'm not going to go through all of those, we can't let our census participation rates reflect our civic engagement in any way, because if we do, we'll be in big trouble. Let's see. I'm not going to go through all of those. So this is a map that GMA and ACCG put together jointly, and it shows the various colors represent different things for counties and cities who have come together who are either the county or the city, and sometimes jointly have formed a complete count committee or are in the process of forming a local complete count committee in their community. I know it's hard to see. The green, any county that's green, it's already complete. The blues are that they're in progress or interested in forming. So again, I'm happy to make this slide available to you, but I just wanted, as we think about... Pardon?
What is that orange?
The orange is, I think it means, oh, I'm blind. I think it means that the chamber, maybe. Oh no, archway. It means the archway was involved in forming that chart.
Okay.
Sorry.
That's the only one you put in orange.
I'm right in front of the screen and I'm blind as a bat.
Okay.
I really need this.
What is white?
White means they did not respond to the survey. So take that for whatever it means for your county.
What is it going to the county or city?
So this, I believe, went to, so ACCG, I believe, sent it out, but GMA has also been working closely so whenever you see like a pink dot, that means the city and the county are doing a complete count committee. So it's hard to see that there are several pink dots. And then there are some counties where it's just a pink dot and for the city and the county did not respond. So it really varies. Some places it's city, some places it's county. We've asked our family connection folks to please be involved in their local complete count committee efforts. So I just wanted to show you all this map and just, again, plug it. We cannot let our census participation look like our civic participation or we are in big trouble. And finally, again, I'm sure you guys have heard this, but I just want to make sure you know where you can get the GMA toolkit for 2020 census. It's just, what?
That's obsolete.
Is it?
They just changed it today.
They just changed it. I got this from Holger yesterday. Holger gave it to me yesterday. Come on. Well, okay.
This morning.
Okay. He should have given me a heads up. He knew I was presenting today.
It'll be GA Cities.
Okay.
GACities.com, I believe, /census.
All right. So y'all know, so clearly census is covered in this room. Fantastic. Again, I just hate to go through civic health and not mention census, because that's like meat and potatoes of civic participation, you know? So, anyway. Okay, well, I guess this is obsolete too. I've had a screenshot of the toolkit, so.
I'll do the same screenshot, do a different website.
I'm glad you know. Awesome, okay. So I think that's about it for me. If you want to contact me about any of this, if you want to learn more about the report, we just featured just a few highlights. But there's more data than the stuff I showed, and there's also a lot of different ways to look at the data across all kinds of demographic variables. So if you're interested in learning more or thinking about how you could look at civic health strategies in your own communities, please don't hesitate to reach out. All right, and I think it is time to turn it over to, are there any questions? Sorry. I'm sorry. Kenny, I'm stepping on your train. All right.
Is your PowerPoint available in the download materials that they put on the GMA site?
Brian?
We can.
Okay. And I'm happy to share with whoever.
And also, we have people who'll come out and speak to groups. If you have groups in your community who would like to do that.
I like those.
Okay.
Yeah, we do have folks who'll go anywhere.
You got the report, but we also have this whole report and article on the website where you can, you know, if you want to email it to people, that you can download the full report and got an overview as well.
And we also did a live from the hall interview with the GMA Communications folks, and that's going to discussing these data and the implications of these data for Georgia. And so that's going to be available. I'm not quite sure how Amy sends that out, but she said, okay. I'm sure it'll be available on the website or the toolkits that apparently are always telling me. So anyway, thank you guys so much. I hope these data interest you and motivate you. Again, because there's a really important role for city officials to play in changing these data. Because I want to do this report in a couple of years, and I don't want these data to look the same. I want to look better. I want Georgians to know how to productively engage with their local elected officials. I want them to know their neighbors. So, you know, I want to improve. All right. I will turn it over to Kenny. Thanks, guys. Just put that back down there. Okay.
Thanks, Rebecca. I can assure you guys, everybody that works with the partnership shares her energy. Everybody. Okay, so that's important. And if you need to contact somebody about anything that's up here, we will be glad to do that. I'm glad Brian pointed out the report in the back. Look at page 6, has all the listings of all the things, and it will, to me, it kind of shocked me, and I'll talk about that later if we have time. But as public officials, 45 and improving our community. I thought that's what we're supposed to be doing, period, every day. But anyway, the next person, we're going to bring up some people that have worked out in the field in their home. The next person is, and I hope I say your last name correctly.
Say it fast, and that'll be correct.
Katie Clark Monkus, okay, is a lifelong resident of Washington County. She is the president of the Washington County Chamber of Commerce. Everybody needs to know you then. She also serves as the Washington County Family Connections Board, and that's pretty good. You have both hats. So please welcome Katie Clark Monkus.
I'm going to stay seated, if that's okay.
You're going to be brilliant, concise, and seated.
Yes, if y'all don't mind. So what we kind of want to talk about this morning is how we've implemented the Civic Health Survey into our community. And obviously, I wear two hats, sitting on the board for Family Connections and then also being a part of our local chamber. It's probably been about 2 years now that I was approached from the rep for Family Connections and asked if I wanted to join in on a grant that was going to allow us basically to complete a local civic health survey. And so, you know, in my mind, I was very interested in that I could use the survey results to be able to implement different programming and set up my plan of work for the chamber. Of course, annually I set up kind of what our different committees are going to do and what we're going to focus on. And this is just another tool for us to be able to figure out kind of what our community needs. Obviously, obviously I'm geared towards my chamber members, but as a whole, I'm geared towards the community in general. And so that's kind of where the chamber I see fits into this, and where you can plug into your local chamber for this as well. And Allison's going to kind of talk about this, but I think it's very vital for you to partner with some entity to be able to do this. You've got to, number one, do the survey, but number two, put the survey results into play. So I'm just going to kind of talk about some ways that we have implemented the results and what we've done with the results. And Allison's going to talk about really the meat and bones of the actual survey itself. But chamber-wise, what we did is we have a youth leadership program. I'm sure you're probably very familiar with youth leadership or a program similar in your communities. And so what we did is we actually implemented a specific session that typically we didn't really have, or we might not have focused on as much. But over the course of a year, we really focused on introducing different nonprofits, civic organizations to these kids, and kind of did like a 411 for them, and let them know that there were ways that they could plug into the community. We are big on making sure that they come back to our community if they decide to go off, which more than likely they're going to go off, receive education, but we want them to come back, and we want them to know that there's a good quality of life. And so for us, showing them as high schoolers that they can plug into civic organizations and have a meaningful impact is very important. We also incorporated a local public official breakfast where very simple things. They were able to have a breakfast where they sat and just had breakfast with the kids. And so they were able to talk to the mayor. They were able to talk to the county commissioner. They were able to talk to those people and have good conversations. And they were able to hear from the youth. And so it's just a 1 hour breakfast that we do at a local restaurant. But that was something we hadn't typically done in the past. But it is well received, great participation, and so that was something that we incorporated, especially after kind of looking at our survey results just in this past year. So just so you know, it takes about a year to kind of get through the process, and then about a year to start putting in place some things. So anyway, so that's kind of youth leadership. We also have a young professionals group in our community, and that was very important for the chair of that committee to be able to show them what the civic clubs are, what the nonprofits are, where they can volunteer. And so as simple as creating a listing of all of those which did not exist before this was just something that we worked on at the chamber. You can find that on the chamber website. Anybody can go there and pull that off. But, you know, being a local myself and a lot of people from our community being locals, we all know everything that's going on, but people that were new to our community did not know ways to plug in. And so for our young professionals group, that was something that was very important to them. Also incorporating a volunteer piece to everything they do. So every session that our young professionals do, they have a give back opportunity, whatever that might be. It might be the local soup kitchen, or it might be the guest speaker who's coming to talk. We, donate towards their calls, school supplies, whatever. But anyway, we incorporated that, and that typically had not been done. But we made sure that that was a big piece of that, and so much so that when we had our first young professionals gathering, we actually asked, what are you interested in as far as nonprofits or other clubs? And we wanted to know what their interests were. And so we made sure that that we were able to touch on those and give them an opportunity. So that is also another way that we have kind of been able to do that and plug in. We also have collaborated with our local city, specifically one of our cities, to create Saturday night concerts. We did several last year, and we did one this year, and that typically hadn't been done. But out of this survey, we realized again that people want to be able to contact and communicate with their neighbors and have opportunities to do so. And we have not had concerts before, any type of function necessarily to do that. And so that went over really well, and we're continuing to do that. But that was something that the chamber specifically partnered one of our local cities on. And I think this survey continues to reinforce that effort. Of course, we have a back-to-school bash, which is, I'm really talking about something that she does, but Family Connections does a back-to-school bash every year, which is just a great opportunity for our businesses to be able to give and donate, and Family Connections to be able to coordinate that event where our students are equipped with what they need for school. So anyway, that is another opportunity for our community to get together and also receive what they need. And that's also another opportunity for our young professionals, our youth leadership, and those that want to volunteer to be able to volunteer. All these things are twofold. I mean, they all serve different purposes for everyone. But these are just ways that we're able to do that. As far as the education goes and reinforcing higher education, we are working on something called Waco Works. Obviously for Washington County, our short name is Waco. And we have put this in place 2 times now. We did it in the fall and the spring. Essentially what it is we target high school students, specifically CTAE students, so those that are enrolled in automotive, business class, those classes, and we take them over to our local technical college, and we show them the programs that are available, and then we show them the business that day. So it's a one-day event, take about 80 kids, and they already tell us what they're interested in. So they tell us if they are interested in welding, if they want to be a CDL driver, whatever. So then those people go specifically what they're interested in. So they go to the business, the transportation business, or they go to the different businesses based on that. We're not wasting time. We're trying to be efficient as possible, especially with that many kids. But we have done that twice now. We targeted our construction automotive kids first, then we did business and healthcare in the spring. And so that is just another way that we are really trying to work on the workforce and the education, and also, again, trying to create an atmosphere so that these kids know that there's opportunities in our community and to stay in our community and have good jobs. The businesses, I'll tell you, are straight up with them. They'll tell you you're going to make $50,000 or you're going to make $80,000 a year, and they love numbers. That's what they want to know. They like numbers. And so these high school kids are able to do that. And again, because we've targeted them, I think it's much more efficient. But that's another way that we have continued just to kind of overlap on all of these things that are coming out of this survey specifically. So, how can we continue the education path? How can we continue to let these people know that there are opportunities and ways to engage, and just kind of have that quality of life and be impactful in our community. Moving forward, what do we plan to do? Because again, we've kind of implemented these things in stages. The iCivics is very interesting to me, and so we have different groups that I think we can plug that into. Specifically for me, I'm going to incorporate that probably into our youth leadership program next year in some shape, form, or fashion. I'm going to find out how to do that. But anyway, the youth leadership piece and the iCivics, I think, is very valuable. Of course, the census, we're going to be working on that and working on ways to pump out the marketing material for that. And a lot of the ways that the chamber can plug into this is because we can promote things, we can advertise things community-wide. And so that's why a lot of people utilize us, whether social media, our Facebook page, we're on that constantly. But anyway, there are ways that we help promote those things. But that census is a big piece that we're going to, of course, be working on. And also another idea that we are going to be putting into place is a volunteer fair. So we want not just students, not just young professionals, but the entire community to understand what volunteer opportunities there are. And so we're working on a volunteer expo where essentially they can come in and just kind of figure out and learn from all of the different clubs we have and nonprofits and things that exist in our community and how they can plug in. And that's just general community members. So that volunteer fair is another piece. But those are just some ways that we have taken the survey results and kind of utilize those. And the good thing is that anybody can look at those results and pick out and plug out what they want to do with those. I think it's enough that it's broad enough across the board. Any entity can take what they need to and utilize it. And those are just some ways the chamber has and/or we've collaborated with others to utilize this information. So I'm going to kind of let Allison talk a little bit about the survey itself so you can understand the process of how you can get this done and what we had to go through as far as local community to be able to have our own local survey. So thank you.
Thank you, Katie. The next presenter is Allison McAfee, is the Executive Director of Family Connection in Communities and Schools in Washington County. Previously, she served on Washington County Family Connection and now resides in Wrightsville.
So yes, I'm the Family Connection Coordinator for Washington County, and we did the survey, and we started in 2017. And what we did to get our results is they created a Survey Monkey for us, and then we also did the paper version. Our survey was unique in that we found out, we thought, well, we'll just go to Head Start and Health Department and these kind of places and just try to target who we thought we needed to survey. But when we got the results back, we found out that we were represented in some categories and underrepresented in others. And so when we were presenting the information, the chamber had a lunch and learn for us, and we were presenting it to the civic groups and some of our local officials. We realized that it wasn't everything that we needed. So we said, well, let's just go back and try this again. Let's add some more people. So one of the things that we were missing were the senior citizens. And how we missed them, I don't know. But Katie and we jumped on board and went over to the senior center and started surveying them. Another one was that we were missing young African American mothers. Don't know how we missed them, because we were doing the health department, we were doing Head Start, we're doing all the places that we thought we needed to be. So we just went out to the school open houses and explained to them what Civic Health was and asked them to participate in the survey. We started out, our goal was 200. We got 212 the first time. The second time around, we got 218, and we got 292 the second time. So in our results, we were a little closer to represent what our census is. So we felt a little bit better about it. But we really learned that there's just certain demographics that don't want to do surveys. But if nothing else, we're getting out there and talking to them about Civic Health and what it is and why they need to be involved. One of the things, Katie told you some ways that we're partnering with the chamber, but my other group is communities and schools, and what we do with that is we target 10% of our middle school that are at risk for dropping out of school. So what we're doing with them is we're providing the information on the iCivics and Civic Health in general to those students and to their parents to try to turn the Civic Health around at an early age. I think that kind of, and one thing that Katie said, and I will emphasize again, is that you have got to partner with another entity. Family Connection can't do it alone. The chamber was key to us getting the survey done. They helped us with promoting it, putting it out on their newsletter. We put it on social media. They put it on social media. And at all of the events, they made the survey available. So you really got to partner with other entities as well. And that's what Georgia Partnership, Family Connection Partnership is about. Anyway, so it fit in very nicely. I'll answer questions, but yeah.
All right, thanks, Allison. Our last presenter is Jill Moody.
Vanderhoek.
Brenda. Okay, I see that.
Vanderhoek's long, it wouldn't fit.
Oh, I was wondering, okay. Is the Executive Director of Community Partnership in Macon-Bibb County. which she considers her dream job. Originally from Gainesville, Georgia, Jill and her husband moved to Middle Georgia in 2004. Okay, Jill.
Thank you. So yes, I've been in Middle Georgia for about 15 years, and I had the pleasure of taking on this role in May of last year. So I still consider myself a newbie because I'm constantly learning things about our community every day. But I was super excited that this was a project that I inherited from the previous folks in my role. And I believe it came on our plate in about 2017 also, but it kind of was stuck. We were trying to figure out the best way to get the county, all the county voices involved in our survey. We had a board member that was really pushing for it to be statistically viable, I think is the way they talk about it. And so we actually had some grant funding. Macon has many foundations in our town, and so we were able to get some funding through Knight Foundation and through the Community Foundation of Central Georgia. And so we took the approach of starting with a random digit dialing survey. And we partnered with Kennesaw State. They put it together in their little computer, and they collected 402 surveys for us, completed surveys. And as we went through this process, we realized, A, it's expensive, and B, it gets more expensive when you're trying to figure out cell phones, landlines, who's going to take 15 minutes to answer a survey about civic health. But we were able to get 402 respondents. What we found when the data came back was that even though we spent all this money trying to get all the voices of our county represented, it still skewed to white, older females. We love to take surveys. So when we looked at the data, we thought, okay, well, that is helpful, but how do we now go to phase 2 and say, okay, we need younger voices, we need more male voices, we need more voices for people of color so that it actually represents Macon Bibb. And so as we go through our data, we can look at the zip codes that did not have as many respondents. And so now we're figuring out, okay, how do we go into those neighborhoods to get paper surveys filled out? How do we get more electronic responses? And so now I'm having conversations with our chamber, with our leadership alumni groups. They're craving projects to be involved, and so this seems like a perfect opportunity for them to get surveys completed. Again, this is a long survey, and so we have to figure out how do we best connect with folks to fill out, I think it's about 42 questions, if you keep it bare minimum. And so we are working on phase 2 of actually connecting with folks in their neighborhoods at community events to get them to fill that out. As I talk about civic health in our area, a lot of folks at first are like, oh great, another report. What are you going to do with it? And my response to is I am committed to not just shelving this report. I feel like this is one of those things in our community. It's foundational. So we talk about, you know, all the other needs in our community. If we build up our civic health, then some of the other issues that we're trying to tackle might not be so big because they start working on each other. It's like a ladder. And so a lot of the conversations I'm having are with church groups, are with our mobile library unit. They like to do things in community centers, and how can we get iCivics through community, through church groups at the churches. When the mobile library sets up, they bring their laptops. How can we get the kids from the neighborhood coming in and interacting? Just last week, the school system, one of their senior level administrators is on my board, the chief of staff, and he said, you know what, I want to learn more about iCivics because one of our focus is on civility, and I think that there's a good connection there. So he's actually connected me to the lead social studies person for the county so that we can start working together to build that. So it's not just overwhelming for the teachers in our school to use iCivics. Another exciting conversation is with our newspaper. Knight Foundation does have a heavy presence in our community, and they are very focused on civic spaces, and so they're involved with the newspaper. And that conversation looks like, what would it look like to have a civic fellow at our newspaper? And then that person could help train community members to be involved in commission meetings and committee meetings so that then those neighbors can report back to their networks. Like many communities, our newspaper is not able to cover the same level that it once was because they just don't have the staff. And the work is done, the city work is done in those committee meetings. So how can we get that information out before it becomes something that's going to be a crisis for the community? And so we're looking at ways to share the information where the newspaper doesn't necessarily have the manpower to be at all those meetings. Something else that's really important to us is developing a civic health strategy team. And what I mean by that is reaching out to organizations that focus on voter registration. That's in our area. We have New Georgia Project, we have Georgia Women, Registered and Ready. They are focused on making sure that our neighbors are ready to be part of any election, local, national, state level. We also have Project ID in our area, which is an organization that provides identification cards for folks that don't have it. And IDs are kind of a gateway to almost everything you need in life. And so they have been very supportive in being involved with the civic health ideas that we've come up with. But the idea of the civic health strategy team is so that we have multiple people coming in and saying, hey, you know, we need to go down this road and make sure that we have voter registration, or we need to make sure that IDs, or, you know, are we reaching out to the youth? How are we doing this? So it's not just Family Connection saying, you know what, I think we need to go in this direction. We have a lot of different people talking and coming together and saying, okay, this is what my lens looks like from the community. And so basically what we're trying to do is build community again. Things that we kind of take for granted are things that we need to bring back into our community. We did rank a little bit higher local versus state with social connectedness in terms of family interaction or doing some things for neighbors. But again, I was shocked when I saw our numbers for interacting with our neighbors, because that's where it all starts. You need to be looking out for your neighbors. You need to be looking out for the people in your community, because when you have a strong community, we all thrive, and that's ultimately what we're going for. And so one of the other parts of our civic strategy is to try and organize the information. In Macon, we have a lot of initiatives, we have a lot of resources, but what we're finding is that it gets very confusing trying to figure out the flow of that for folks that are trying to access those resources, but for folks that just need to know that the resources are out there. And so we're trying to kind of bring those organizations together so that we have a clearer path of how to kind of navigate the resources and information. And the last piece of our civic initiative, which was already started when we were collecting information, but through the Community Foundation of Central Georgia, they brought On the Table to our community last year, which is a civic dinner, civic meal. And what was great about this is we, on October 18th of last year, we had 5,000 people all over the county sit down at tables. Some had snacks, some had desserts, some had full meals. It wasn't really about the food, it was about getting together and having face-to-face conversations. And we are having that initiative again in our community on October 30th, and the idea is to expand it to make sure that we have more voices, because in their feedback, they also got very similar results in terms of who was participating. And Community Partnership's role on the table is, how do we get into all corners of our county? How do we engage people that might feel that they're too busy to sit down and have a meal with their neighbors? How do we make sure that everyone's voice is represented in our data that we're collecting? We've had ideas of, why don't we put it on the bus and have a mobile on the table? So people can enjoy a conversation as they're going on to work. Or maybe we put it at the transfer station, at the terminal, so that as people are switching buses, they can sit down and have a meal. What does that look like when we expand it so that it involves everybody's voice? So those are some of the things that we're doing in Macon.
Okay. All right. I was going to say, let's thank our presenters for spending their valuable time to help us. Thank you. We've got a couple minutes left, and I wanted to I was going to ask a question, but I think I feel better if you guys had questions for anybody up here. Yes, sir.
How did you write your base set of questions for your survey, and how did you add to that as you found the need? What were your sources of questions?
Do you want me to take it and then you'll jump on? So we wanted to be able to compare local data versus state data in the 2013 Georgia Civic Health Index we did. So we actually contracted Georgia Family Connection Partnership with a data analysis firm to implement the exact same survey that's used to build the Civic Health Index at the local level. We're the only state that's been able to do that. A lot of other states have tried, but we have the Family Connection Network. So that's how the survey was built. It was the exact same survey that built the Civic Health Index, and then our local collaboratives and local communities were allowed to add what they considered locally relevant questions to get a little bit richer data. So for example, I know there were some communities that added some why questions, so that when you saw low participation rates, you could have some, well, if you don't vote, why don't you vote? You know, that kind of thing. But that's where it started, is with the actual Civic Health Index.
So is that template available on your Family Connections website or anything like that? Or?
It's not on the public website, but I could send you the template. Okay. It's long. It's really long.
It's about 42 questions.
Yeah, the one we received was, it had red, it was marked up in red if you could not take it away, and then there were additional things, and so we just simply went through it, and I think honestly, we just decided to go with the ones that you were kind of suggested to utilize, the red questions, and it ended up about 42, 43 questions.
Could you repeat your email address again?
Me?
Yeah, you had it on the slide earlier.
Oh, yeah. It's Rebecca, REBECCA, at gafcp.org. CP. Yep. And if you want to go on our website and explore, it's just gafcp.org.
Anybody have any? I wanted to ask, well, first let me say, please get that report, and on page 6 it has all the listings as a group. I know what I'm going to do is pick 2 or 3 of those topics and try to work on those, because you can't fix everything. But I wanted to ask the panel, what do you guys look for or hope that your elected officials do in your areas to improve civic health?
I think for us, one of the things that we could really incorporate, which is what you talked about, Jill, that having open conversations, creating opportunities for the people in the community to be able to sit down and have conversations. And I see that as a way that Family Connections and Chamber of Commerce, that we can help create that and make that happen. But I do think that that's a way that through this study, you can look at this information and see that that's probably one of the obvious ways, whatever that might look like. But just creating opportunities, even if it's you take a group that you already have established through something else and say, all right, you're going to sit down and talk to your mayor or city council or whomever. But I think that that's an easy way that can collaborate through this process. And I'm speaking relative to my community, and what I see could be an open door for that as far as a possibility and something that we'll probably look into, so.
And especially finding ways for our teens to plug in, because the teens really are interested in talking to elected officials. They want their voice to be heard, but they don't necessarily know how to go about doing it. So any ways that you can make opportunities for the teens to make yourself available, they really do want to be heard.
The last thing I'm going to close with, your partnership, your collaborative in your area is geared toward your needs of that community, so they can be a little different in each county. So I know Katie has said something earlier about new people that come to your community that don't have a full knowledge of that area is critical. So please, among other things, know your collaborative, because they work for you and they benefit your community. With that being said, I want to thank everybody for coming today and enjoy the rest of the conference. Thank you.